This conference will now be recorded.
بسم الله الرحمن الرحيم وبه نستعين. Today we have an informative introduction to MRCOG and help you and guide you. And aim of this presentation is help newly graduated and even postgraduate in term how to join obstetric and gynecology in UK, either for a training job or and getting national training number, or even for a service job or MTI. First of all, I want just to introduce myself. My name is Dr. Rasha Homida. I hold my MRCOG full membership 2019. I am a senior obstetrician and gynecologist, now working as ST4, ST5 trainee in UK. So welcome all of you. My main aim is that to help overseas who struggle to join and struggle to find a way and a guide to start training in UK. So as I mentioned, the aim of this presentation is to help newly graduated and even postgraduated, and also to make a decision regarding why they are going to choose MRCOG. Okay, so is my voice is clear till now? Please. Can you write to me just in the chat if that my voice is clear or not? Okay, so our agenda today is that to talk about why MRCOG, why you choose MRCOG, and what are the different pathways to start obstetric and gynecology training in UK, and how to prepare for MRCOG Part 1, common reason for failure, and 10 keys for passing MRCOG Part 1, and single best answer sample question and answer from recalls, and also to talk about MRCOG Part 1 online course by MRCOG Tutor. And just I want to tell about what is MRCOG Tutor, which is an online platform help and support candidates who are going to starting their exam, like MRCOG Part, so helping for MRCOG Part 1, MRCOG Part 2, and MRCOG Part 3 as well as the courses, and even helping people who want to enter training by guiding them how the application process and all the pathway for training requirement in UK. Okay. So why MRCOG? Why people choosing MRCOG? The first thing I think this is MRCOG is an an overall you will provide the best care for your patient because you improve your approach to diagnose condition, give you self-confidence, and your colleague will be trusting you, and you will have a good understanding as well. And the second thing is that MRCOG is an internationally recognized academic excellence and quality of teaching, because this is a qualification which has been designed to test the skills, knowledge, clinical behavior of doctors specializing in obstetric and gynecology. And it has three parts. Part 1, which covers the basic and applied science relevant to clinical practice of obstetric and gynecology, and for Part 2, which is assess the application for your knowledge in clinical scenario. And in Part 3, also clinical assessment of knowledge, skills, attitude, and competencies. So MRCOG is the leader in obstetric and gynecology all over the world. Okay. So that's one second reason for why we are choosing MRCOG. The third one is that your knowledge will be updated. So is that not just an exam. So the doctor are regularly checked against the professional standards that set by the GMC, and doctor will be updated with the new treatment design for women's medical and surgical condition. and for various women medical and surgical conditions regarding obstetric and gynecology. And the fourth things, which is building your career forward, and that is by getting MRCOG certificate that improve your CV, opening a new windows and a new job opportunity, as all overseas know that. Okay, and giving you also a chance to enter obstetric and gynecology training in UK. And also, as we know nowadays, staff shortage have been growing in the NHS for years. So this led to that the NHS opened many training opportunity in different specialty, included obstetric and gynecology and even service job. So, so that will give you a chance to enter obstetric and gynecology training in UK. That's one of the benefit of MRCOG, and also allows you to work in UK. So there is a different pathway. I mean, anyone have a different all people have different goal and different aims. So people want to come here to start training. People want to come to UK to just learn new skills. Some people want to stay there. Some people just want to have to gain a certificate and go back to their home and to apply this knowledge in their back home country. So a lot of things in different situation. So first, you may think that it is difficult. It is a difficult pathway, but try to take the challenges in every step and find a solution and be up to your challenge, and always give a time. So it is not necessary that you will finish. For example, if you and set a goal, it doesn't mean that this goal will end just, for example, for one year you will go through all steps and just finish. No, you give time, because that also will not make a pressure on your family and if you have a family. So this is very important to give time. So work on that and reach and achieve your aim. So also the last thing is that promising employability and career opportunities. Okay, and that is which open for you, as I mentioned, a lot of job opportunity in terms of service job, in terms of training job, and even MTI, which is nowadays the college asking for MTI and recommend to go for MTI. Okay, so if some people ask me, they told me that is that better to finish MRCOG before coming here? For my opinion, because I saw here the workload and it's a little bit difficult. From overseas, our country is different from UK. Very cold. Even the usual things in this country, it is a little bit difficult. So the first year will be difficult, definitely. So for me, my opinion is just according is to your aim here. So you came for to train, or you came for just to build your knowledge and build your skill, or you came to stay. So that would be the difference. So if you came for training, I think better to finish your MRCOG, because the training here is you have a lot of things in your back. In terms of the working hours, you will cover 12 hours sometimes in 1 week, and sometimes you cover 12 hours more than 4 times in a week. So it's a little bit difficult for you to balance between finishing MRCOG and for even and to complete your training. And I saw a lot of people who are taken out from the training because of the MRCOG part 2. And I saw that because, as we know, more than 6 attempts you're not allowed to enter the MRCOG part 2 again. So most of them, they are taken out from the program. So it's a little bit tricky to come in a new country, and even in your daily work and seeing patient. It will be a difference between patient. Between a doctor who finished the MRCOG and doctor who still couldn't finish the MRCOG in terms of dealing with the patient as well, because MRCOG part 3 giving you the opportunity to have to build a rapport and to build patient communication, which is very important here in UK. So my opinion is that to finish MRCOG before coming here, and that's always I'm saying that for all people who ask me. And I don't know if all people know me because I actually I help more than a lot of candidates who taking part two especially, and I did a lot of courses for part two, part three, and also for part one. So always I'm telling that better to finish MRCOG from the start so that you can that will help you a lot in terms of you come just gaining a skill, and then it will be even for your house and your family. I mean, you will be a little bit, you will be have a time to see and look to your family as well. So what is the CCT pathway for obstetric and gynecology, which is for the international medical graduate? And CCT is that certificate of completion of training, and that is a pathway for the obstetric and gynecology training. So this is actually, as you see here, according to the GMC, is that you have either 2 years UK foundation program, and that's usually for the one who is I mean, graduated from UK. Usually they are doing that. Or if you, for example, came from your country and you did the internship, so you have another, for example, 1 year UK standalone FY2, or 1 year UK WASP, or 1 year post-internship experience in an acute specialty UK or overseas. Okay, so usually they are coming 2 years usually, and then after that, you have different pathway. I mean, either to enter the training. So either to start from ST1 or to jump to ST3. Okay, and that I will be discussing today in this meeting. So for ST1, ST2, you will start training by ST1, ST2, and then you should finish your MRCOG part 1, and then going to ST3, ST5, and then after that, after ST5, you should finish your part 2 and part 3, and then go to ST6, ST7, as you see here in the in this graph. And also after that, after you're finishing ST6 and ST7, you will finish your training, and you will gain CCT obstetric and gynecology in UK, and that is a recognized certificate, and you will work as a consultant in UK and any other country. And then you will hold the name of obstetric and gynecology consultant. Okay, so what are the different pathways to start obstetric and gynecology training in UK? The first thing is that you have the pathway of ST1, which is, as I mentioned before, but the pathway is, I mean, the pathway today I will go through it. So that's one of the pathway, which is ST1, start from ST1 and finishing till CCT, and to gain CCT, or to start from ST3 and then gain the CCT. And usually nowadays, and that's my pathway, which is I started from ST3 last year, and then I already finished my membership. And the last pathway is that to go for a CSER pathway, which is Certificate of Eligibility for Specialist Registration pathway. And that is actually usually for overseas who came and they are a consultant in their country or a senior specialist, and they have a good experience. So when they came here, they make OSAT. What is OSAT? Is that competencies through their consultant, okay, working with them, so that they can sign for them, and then at the end they will finish, which we call it CSER. And CSER pathway, as I understand, is that it is not recognized as a consultant outside UK. It is just for UK here, but some countries was at the beginning consider it as a consultant, but nowadays, as I remember, Saudi Arabia, one of the, and I think also UAE, as I not recognize it as a consultant in their countries, just as a senior specialist. So, but if you are in UK, you will be they will deal with you as a consultant. So it also have a lot of papers and a lot of things through the GMC. It will be signed through the GMC, and then at the end you will get a Caesar pathway. What is oral? So oral is for ST. If you want to enter training either by ST1 or ST3, you should have profile in the oral. And this profile, you will put all your details, your name, date of birth, your certificate, and all things. And then according to when the application for a training is open. So Oriel is a UK-wide portal and recruitment system for postgraduate specialty medical, dental, and public health training vacancies. And Oriel enable applicants to register for training, view vacancies, apply, book interviews and assessment centers, and manage offers as well, all within a single central location. So Oriel is not just for obstetric and gynecology. It is from the start, it is a dental health training, but it's open for also medical health training. So they are using it as for all other specialty, not just for obstetric and gynecology, anesthesia, orthopedic, all the other specialties. They are using Oriel to apply for a training job. For starting training as ST1, the first thing is that the application window to open. So you will do your profile, and then you will prepare your profile to be ready in the website. You will have account. You have sign in so that you have a password and username and password. And then when usually just all the time, for example, every month or every 2 months, just open and see what specialty you want to go for, and then it will be open for you, the time and the date when it will be open. And if it is open, so you will apply, application window to open, you will see it. And for ST1, we have a CREST form, and that is in the Oriel, or even in the ST1 obstetric and gynecology. If you go there and just search by Google, you will find the CREST form. And then application window to close, you will know it from the Oriel, invitation for MSRA, this is the exam for ST1. And then you will get the result, and it is usually MSRA, it is nearly from the blab test. So usually people who are taking the blabs, they're going for MSRA, which has become easy for them. So I think for people who is just newly graduated and they just want to make money and just they want to work a little bit, gaining money, I think they can go for this one. Or if they not want to gain money, they can go for this, so that just they finish and then they come. But if you want to gain money, you better to go for ST3, because you will have experience, you will have an MRCOG and all this. So in ST1 MSRA, there will be the result, and then the preference open for you, what is the preference is that the hospital which need ST1 trainee, they will be open, and then just you will see according to the area you like to. Usually people taking the area who friends are there on this area or are trainee on this area, so they will be helping each other. Okay, so then interviews, initial offer, and hold deadline, and then upgrade deadline. For ST3, so also the application will open usually in the last week of November, and application window open, and then you will have alternative certificate, that will be downloaded from the system, be signed by your consultant. You will tick all the requirement in this certificate, and then after that the application will close, long listing, short listing, and then invitation to the interview, and then preference open on Oriel. After that you will put your preference. What is preference? As I mentioned, it will be open for you, so you will choose which area you want to work in, and that will be at the end according to your rank and score. And then the interview, preference close on Oriel, and then initial offer released, and then hold deadline, and then upgrade deadline. Upgrade means that if you're, for example, you don't like to be on this area and you want the area which is above this, you put it in your preference. For example, you want you don't want for example, you have been taken for number 3 area. If you don't like this and you want number 2, so you will apply for upgrade. Okay, so upgrade mean that they will put you in the previous one, so they will put you in the second, and according also to your rank. Any questions so far till now? Is my voice is clear? Okay, so don't forget full registration to the GMC. That's the most important and mandatory in all these steps. But what I want to tell you is that even if you apply, if you don't get your GMC registration, it doesn't matter. Why? Because you will have, you can apply telling them that you have OET exam, uh, for example, on that day, and put the date, and then they want you by the starting of the by by starting of the slot to have the OET. So it is not a problem if you started before. If you apply and you didn't have OET. Okay, that's most important thing. But you should know that for registration to start the post is very important. Okay, so for ST1 you have OET plus lab test, and then to register for the GMC. Okay, and then for OET plus membership, that is for MRCOG. And as we know, MRCPI now was recognized to be one of the certificate is that to have a full registration to the GMC. Okay, so you can apply and work hard to get your OET exam. To maximize your chance in getting national training number, you should do an audits, research, quality improvement project, and involvement in teaching, and all these things we in our MRCOG Tutor platform, online platform, we provide all support for how to do audit, how to do research, and even quality improvement project, so that they will maximize you will maximize your chance to have the training post if you are like to go for national training number. Okay, and also involvement in teaching. And also the third thing is that sometimes also certificate like diploma in teaching, master in for example in medical education, all this also will get you will have a good score. And also for ST3 they have assessment form, which is very important when you applying, so that you will know your score when you apply for that. So what's MTI? Anybody you know what's MTI? Can tell us about MTI? Hello? So MTI is a medical training initiative scheme, okay? And this is actually allows international medical graduate to come to the UK for a maximum of 2 years to train in within the NHS. And definitely overseas people will get benefit and will gain knowledge, skill, technique learned within the NHS, and can make them to improve the level of care when they go back to their home. And in addition, also the UK hospital will also benefit and provide a placement for this international medical graduate, and benefit from their presence. And because of the staff shortage in NHS system in this time. So nowadays the RCOG encourage the international medical graduate to apply for MTI only once they have passed part 1 and part 2 exam. However, also just I want you to note that part 2 is not a mandatory requirement for eligibility to apply for this scheme. So if you have part 1, that's okay. Just you will do OET and then finish. But part 2 is not a mandatory. But if you do, they recommend RCOG better for you to come with part 2, because as I mentioned, you will have a good grip of knowledge in dealing with patient, dealing with condition. Okay, so for MTI, as I mentioned, you must have a valid part 1 MRCOG exam pass result, And also you should have a assessment of training, which is AOT form, and that is with a 4 year of supervised postgraduate practice in obstetrics and gynecology, which have been approved by the RCOG examination department. Okay, and also logbook for clinical evidence, and all these things and details, it is written already in the RCOG website about that. And yeah. Okay, so now how to prepare for MRCOG part 1. Okay, so the first thing is that to create an account on the RCOG website, submit your MRCOG Part 1 eligibility criteria for approval before Friday 29th of September, which is next week. Book your exam date, book available person view test centers, fees according to your banding. Banding means that according to your, because the RCOG put countries in a banding area, so according to your banding that the fees will be. And the study period, usually I recommend 3 to 6 months. If you enter before, so I think 2 months is enough, or even 1 month if you just want revision. Always go back to the RCOG website for any update about the exam. So if you want to go for MRCOG, you should know regarding the paper. So which paper is, for example, paper 1 and paper 2. So for example, in paper 1, the anatomy is most likely the highest figure, and also endocrinology and also physiology. So you should grip these big topics first and then go for the smallest one. And also for paper 2, if you saw that the pathology, the clinical management, data interpretation, it have a good grip and a good area. Start with the thing which is with a big and also microbiology, if you see. So I think start always by the thing which is more have a more percentage. Okay, so as you see here.
Okay.
So for MRCOG Part 1 exam timetable, the timetable for the single best answer, usually the exam is single best answer, paper 1, duration 2.5 hours, which is 150 minutes, and the number of question is 100. There's a lunch break, which is approximately 1 hour, and a single best answer is for paper 2 is 2.5 hour, which is 150 minutes, and then and then the number of the question is 100 as well, SBA. That is a person view, which is authorized test center, and you will book yourself according to your area. About the study books, about the study books, so study books, revision note book is the most important book for you. Read it many times, and just I want to let you know is that it is not unauthorized by the RCOG, but just I saw that a lot of people gain a benefit from that, and they recommend it. And it's, I think, also it's old enough, but just it arrange the all the topics in a nice way. So read it many times. Basic science in obstetric and gynecology also for Philip, and basic science in obstetric and gynecology for Austin, also they are good. And if you have any conflict in terms of recommendation in treatment of any topic, or controversy between different topics or different modalities of treatment or management, go to the RCOG website and open the Green Top guideline and take it from there. Also, I saw many people using Dr. Ahmed al-Bahuti book, and a lot of candidates use it and was very useful for them. So read and practice question is very reading and practicing question is very important. So go for the recalls, and that is covered in our course as well. So go for the recalls and go for the question just to fix the point and fix the knowledge. So what are the common reasons for MRCOG part 1 failure? The first thing is that rushing to sit the exam or to resit mean that still you didn't arrange yourself well. I mean, there is no time for you, for example, to study, or you didn't revise many time. So I think rushing to sit the exam, it will put you to fail, and also make you anxious and lack of confidence. So better to give time all the time. Better to give time to study well and to do your things in a good way. So lack of confidence because rushing, because if you fix the information and the knowledge well, you will be self-confidence, and you will have this self-confidence, and you will pass the exam. Also poor time management in terms of, for example, you don't have a good for example schedule you put, because if you put a good schedule, arrange yourself according to your rota at work, for example, that will help you to gain your and achieve your goal. So poor time management, for example, if you are working 12-hour, you should have a time at least 1 to 2 hour just to study. So according to at what level you are busy. So if that's the case, mean that you need more time. So arrange time and then give time as well. Lack exam technique, which is you don't know how this exam work, how to solve the SBA, and that I think if you go with a study partner or with a group solving, that I think will be good for you, because you will know how to answer the question. Lack of preparation, which is also it is not just a matter of just to pass the exam. I mean, to go and you are a hero to pass the exam. Any exam need to study, and at the end you will pass. Distraction in terms of family, in terms of work, in terms of a lot of things, even your mobile, using all the time your mobile. So distraction is very important to take uh, rid of it, because you need to focus on your goal and you need to focus on your study every day. And also wrong resources, so to have don't go in a lot of resources, just stick to one resource and see what you gain from that and apply that on questions. So always remember that hard work in science in silence, let success make the noise. So what are the 10 keys for passing MRCOG part 1? The first one is that strategy and aim, which is apply knowledge, not the pure knowledge itself, but also practicing your ability to apply knowledge and practicing strategy to be more confident and keep reminding yourself. The guidance, either by asking for a guidance or as always follow success people, not necessary to copy them, but at least as a kind of inspiration. And sometimes people done things and succeed. And also some people, they'll go into courses with tutor and instructor to save time as well. Some people do that. So it is a matter of just to reach your goal at the end. The third thing is that smart study plan with time management, and that to find a new way to learn and to stick to it and take advantage of free session of mentors, what they are doing. So watch what they are doing, what they said, and that you might difficult topics you don't know how that this topic come. So you can just from free session you can learn from that. So don't So take the advantage of the session, of the free session of the mentors, and also set your target for every day and put a plan for every day as plan and get it done, and gives your target as well and get that done. Never compare. Never compare, because your status, your situation, your experience is different from others. So never compare. Keep your concepts clear, and just try to apply the knowledge, and also at the same times make your concept clear so that you can apply this knowledge in any scenarios you have been taken. Practicing your ability to apply knowledge by solving many SBAs and repeat recalls. Learn from mistakes. We all learn from our mistakes and learning points. So this is very important to put it in your mind. And the last thing is action and success, which to put a strategy, to put a plan, teamwork, action, and succeed. So tips before the exam: sleep well the week before the exam, take a regular healthy diet with exercise if possible, relax, pray and pray. Always remember that you are never alone, and study till the day of the exam. Okay, some people they said that no, I'm just the last date, I just want my mind clear from anything. No, I think even before the exam, just take this the thing which is, for example, revise the incidents, for example, in the exam, revise the thing which is need to be revised till the end of the end, till the last day of the exam. Okay, focus study at the last, just scanning, see what's more important things, solve confusion question and make sure of the answer in different ways. So ask other colleague, ask your study partner, just make things clear for you before the exam. Tips on the day of the exam: try to reach the center a day before the exam and 1 hour before the exam scheduled time. Make sure that you took your ID passport with you in your bag. Sleep well, nearly 8 hours, and have your breakfast early and take a chocolate with you for energy. That's very important. Tips inside the exam. The first thing is that to score high is by the following advice: read the questions well again and again. Read the question well again and again. Okay? By systematic in answering question, avoid jumping from one to another. Avoid misplacing the answer, particularly in the SBAs. Okay, so try to think about this question. If you start and this question was very difficult, better to leave it and go for the next, because this minute or this 2 minutes you can solve two questions which is easy for you. So try to, if you have a difficult question, try to leave it at the end. Make sure you have put the answer in the right place. Avoid tight clothes or uncomfortable shoes. Take paracetamol for just in case. Maybe you need it, okay? Because of stress and anxious of the and anxiety of the exam. And the most important is that the visit toilet just before the exam, and don't drink any energy soft drinks like dizziness or because that will cause dizziness and confusion, and diuretic also can cause that. Also, don't panic if you see unfamiliar question or you know nothing about the question. Just leave it to the end and don't waste time. Don't discuss your answer in between the exam part with anyone. So be strong, fighter till the last question. You deserve the pass at the end. Hard working is very important, and teamwork as well. And if you believe in yourself, anything is possible. So coming now to the SBA sample answer question, which is from the recalls. Okay, so this is the first questions from January 2022. and asking about name this structure. Anyone can answer? Hello?
Yes, doctor.
Yes, so can you read the question?
Name this structure. Superior fascia of urogenital diaphragm, inferior fascia of urogenital diaphragm, perineal membrane, collis fascia, and scarpa fascia.
Okay. So what do you think the answer?
I think it's collis fascia.
Yeah, excellent. Yeah, excellent. So Colles fascia, and in just to explain that, as you see here, Colles fascia is the most superficial facial layer in the perineum. Okay, so if we go back again, that's the perineum here. Okay, and that is the superficial fascia of it. Okay, so if we make a diagram here, for example, like this diagram. So that's the superficial space. So that's the urethra, and we have two space, superficial and deep space. Okay, and the membranous layer of the superficial space is called the Colles fascia. Okay, for example, in this more obvious, for example, we have two space. That is the superficial, which is this one, and that's the deep space, which is deep perineal space. So for the superficial perineal space, the superficial fascia of the perineum is called Colles fascia, and then for the deep perineal space, inferior fascia, and the superior one is the superior fascia of urogenital diaphragm. Excellent. Okay, who can read the other question?
Mechanism of action for marinal
Myrina.
Myrina LNG. Yes. Inhibition
Mhm.
of ovulation, inhibition of fertilization, inhibition of implantation, induces endometrial atrophy, induces thickening of cervical mucus.
Mhm. Okay, so what is Myrina? You know what's Myrina? Okay, so Myrina is intrauterine system, which is a hormonal type of intrauterine device. Okay, T-shaped plastic device that is used to release hormone, which is hormonal type of contraception, and it is intrauterine. So mean that we put it inside the uterus. Okay.
Okay, doctor.
Yeah. So there's a different actually action for a different type, which so Myrina is one of the type of contraception. It is used as a type of contraception. It is used for menorrhagia, which is heavy menstrual bleeding. Okay, so what is the action or mechanism of action for this Myrina? For example, if we said that Myrina is for heavy menstrual bleeding, so most likely which one will be the thing? What do you think?
Maybe A.
If we said that this Myrina is for heavy menstrual bleeding, so mean that we will usually the heavy menstrual bleeding mean that the endometrium is uh, hyperplasia. Is that right?
Yes.
Yeah. So if we use it, mean that we will um, decrease this hyperplasia and make it like induce endometrial atrophy, which is lead to decreasing the amount of menstrual cycle. Okay, so what do you think the answer?
Induces endometrial atrophy.
Yeah, exactly. Excellent. So that's the answer, which is induced endometrial atrophy, because by that, it will, because endometrial hyperplasia most likely due to estrogen hormone, and if we, which is unopposed estrogen. So if we give Mirena, which is progesterone hormone, it will induce endometrial atrophy and then decrease the, the blood loss. Okay, so yeah, answer is D. So for inhibition of ovulation, the COCP, which combine pill, do that. The DMPA and the implanon, all these inhibit ovulation. For inhibition of fertilization, which is for the Cooper IUD, and also Cooper IUD, it inhibits the implantation as well. And also, as I mentioned, for Mirena, it induced endometrial atrophy, and for many pill, which is progesterone only pill, that induce thickening of the cervical mucus, which is prevent or as a method of contraception. Okay.
Hemolytic anemia test for baby. Indirect Coombs test, serum ferritin. Direct Coombs test, serum hemoglobin, serum transferrin.
Mm-hmm. Yeah. So, uh, what do you know about Coombs test? Okay, so Coombs test is a kind of blood test used in immunohematology. We have a direct or indirect Coombs test. Okay, so usually the direct Coombs test is that used to detect antibody that are stuck to the surface of the red blood cells, and for indirect, and that is usually um, for most likely done for the babies, okay, the neonate. And for the indirect Coombs test, which is to detect the antibodies that are floating freely in the blood, and that's most likely for the woman. Okay, and that is most likely the indirect Coombs test used to screen pregnant lady for antibodies that may cause hemolytic disease of the newborn. Okay, so from that, what do you think this answer?
A.
Indirect Coombs test or direct? We said that the indirect used to screen the pregnant lady. And the direct Coombs used to for the neonate.
So C.
So C, exactly, excellent. So C is the answer. Why? Because, and that's actually one of the recall questions. If you see, it came on January 2023. So direct Coombs test is, this is the test that is done on the newborn's blood sample, usually in the setting of newborn with jaundice. The test is looking for foreign antibodies that are already adhered to the infant's red blood cells as potential cause for hemolysis. Okay. So what is the hemolytic disease of the fetus or the newborn, also known as alloimmune or erythroblastosis fetalis, is caused by the destruction of red blood cells of the neonate or the fetus by maternal immunoglobulin IgG antibody. Okay, so that is the
Okay.
direct used by the neonate, a newborn, and the indirect used by to screen pregnant lady for antibody that may cause hemolytic disease of the newborn. Okay,
Okay.
yeah. So that is the direct Coombs test and indirect Coombs test. and how is this agglutination. Okay. Also, this is one of the exam question, July 2022. 29 years old, prima gravida, 23 weeks, with nearly 3 months of history of weight loss and dry cough.
Tuberculosis.
Tuberculosis, excellent. So yeah, this lady most likely because she had a weight loss, dry cough, and that's most likely. Even the features, if you see the features of cavitation in this chest X-ray, if you saw there is a cavitation, there is a consolidation as well. Yeah, so and also there is higher enlargement due to lymphadenopathy. So most likely that is tuberculosis. Excellent. For example, the things between others, for bacterial pneumonia, usually we will see like it will show for acute bacterial pneumonia, usually it will be lobar pneumonia, and there will be also it shows presence of disease and pulmonary infiltrate. That's for the bacterial pneumonia. For bronchiectasis, most likely, usually you will see lung scarring in the chest X-ray if they came to you. And in actinomycosis, it is usually non-specific features. So either consolidation or so it's not a character. There is no definitive characteristic for actinomycosis, and for constructive pericarditis usually showed pleural effusion. Okay, so now talking about what is MRCOG uh, online course by MRCOG Tutor. Okay, so this is an online course by MRCOG Tutor for January 2024 candidate. What our course benefit and why you go for our course, because we are providing tips and best preparation to reach your dream of passing MRCOG Part 1 and from the first attempt, and even go through all the parts, Part 2 and Part 3, going through all the syllabus as per the RCOG website. And this course is recommended for candidates who are planning to January 2024. It works through the module of the core curriculum, including how to approach the new exam format and how to get the highest score. As well, the course duration is 10 weeks. Usually it will be every weekend. There will be intensive discussion of the recent 3 years recalls, 3 to 4 years recalls, and final 3 mock exams under exam condition. Provide Telegram group for daily activity, and also guidance on how to come and work in UK, taking you through all the training process. All recording of the session will be available till the exam date. Memory cards for important topics will be provided as well. Okay, any question?
No, thank you.
So the course benefit is, what is MRCOG? Is an academy. So we'll take you through MRCOG Part 2 and MRCOG Part 3 and celebrate your achievement together. It find help and support if you decide apply for the obstetric and gynecology training in UK, and taking you through what you need to do from now. So it is not just to have just to pass MRCOG Part 1, but also taking you through from where to start, what to do, and how to do audit, how to do researches, quality improvement project, and that will help you build your CV and build your training opportunity, and you have a good I mean uh, say a lot of things and a lot of in your, if you want to apply for the training program or anything, so you will, all things will be done, and it's not an easy to be done, in 1 year. So you need to start from now to do all these things, so at the end, if you get a training, if you want to apply for a training job, all this, just it will be like a tick box. So we will give you all the support for to reach the obstetric and gynecology training. In the same while, even if you want to to have a just service job, or even if you want just to have the exam and to stay in your country, as overseas, and you don't want to come here, also we will support for that. So you will find all the help in the our website, which is mrcogtutor.org.uk. So all things will be given for you, answers will be provided by me, and if you need any support or anything, just text me. I have also the website connect me with my WhatsApp, so anything will come to me. That's my candidate who I give them part one course last at the beginning of this year. So, and also for part two as well. So hope you finish like them. And always remember that strategy, plan, and also teamwork plus action, that will give you achievement and success. Many thanks and good luck for all, and all the best.
Thank you very much, doctor. That was so helpful.
Okay, that's good. Thank you. All the best. And if you need any help, just text me.
Okay.
Okay. Thank you.